Three important heart-healthy components of eggs are often forgotten about amongst healthcare professionals, but they're exactly why you should be recommending eggs to your patients more often than you think. First, eggs are a bioavailable source of lutein and zeaxanthin. These are dietary carotenoids with antioxidant and anti-inflammatory properties. Second, eggs are a source of long-chain omega-3 fats, which have been associated with heart health benefits. Often medical professionals recommend fish for omega-3 fats, but eggs provide some omega-3 fats too. Third, eggs are relatively low in saturated fat, especially when compared to some other animal foods. The majority of fat in eggs is healthy unsaturated fats, including monounsaturated and polyunsaturated fats. Of course, the list of great things about eggs isn't just limited to three. Eggs also provide a range of vitamins and minerals important for overall health and well-being. Studies have linked being deficient in some of the nutrients found in eggs with an increased risk of heart disease, including iron, vitamin B12, E and D. To review the latest information on eggs and heart health, visit australianeggs.org.au/healthcare professionals today.